We're talking today with Aiden Long, who is the Communications and Strategic Engagement Manager with Asthma Society. And you're very welcome to the show, Aiden.
Thank you very much. Thanks for having me.
So you might start by telling us a bit about asthma, what it is and how it affects the sufferer.
Yeah, of course. So asthma is a condition of the airways. So it affects your air passages and they go into your lungs. And basically what happens is they become oversensitive. So things that may not affect most people, like dust in the air, cold weather, even smoke, can really affect, or pollen can really affect somebody with asthma. So they're oversensitive to certain triggers like that. And what happens then is the airways become inflamed. It's different for different people, different levels of severity, so it affects different people in different ways, and everybody has different triggers. But basically, it becomes inflamed, it becomes more difficult to get air into your lungs and out of your lungs, as we were just talking about. And eventually, they can fill with mucus, and that can lead to an asthma attack. So it can be really quite scary at that point. But basically, that's what the condition is. We don't know what causes it.
That's mad, isn't it?
Yeah,
still,
even still. Yeah.
Sorry, is there a distinct difference between COPD and asthma? Are they two very separate conditions? Or
they're separate conditions.
In any way?
They are separate conditions. It is possible to have both. Right. So you can actually suffer both, and if you have both, you are more likely to suffer more than if you just have one or the other. Right. So they are separate conditions, but they can affect the same person, and there's some overlap in the symptoms as well. Yeah.
I remember a long time ago doing a allergy test, which was just little drops of liquid onto my skin just to see what I was allergic to, and there was some mad stuff. Sheep.
Oh, right.
Mice,
wow,
rats, cats, dogs, cows.
Yeah.
I mean, where does all that come from? Do they still do that kind of stuff?
I don't know that they do it specifically for asthma, although I'm not sure, to be completely honest. But I do know, like, there could be a number of different things that can trigger your asthma. So, like I said, it could be cold air. Pollen is a big one. So people tend to suffer in the summer months, so from May to September, and then other people might suffer in the winter months. So in the cold air, for example, the damp, it could be mold. Some people, aerosols can affect them, perfume, all of those things can trigger off your asthma. So it's really different for different people, and I think it's, as you kind of understand your condition more, you kind of figure out a bit more. I don't know the specific test, but you figure out a bit more what triggers your asthma, and that's why it's really important to work with your healthcare professional to have what's called an asthma action plan. So they'll sit down with you, and it's something we provide. It's a document that you can download for free on our website, and the idea is you would sit down with your healthcare professional and you would talk through what triggers your asthma, what to do when it gets worse, the type of treatment options available to you, and ultimately then what to do if you're getting really bad flare-ups. So so all those things can trigger asthma.
So talking about treatments, what are the treatments?
So there's a number of different treatments, and again, it's really personalised for the person. So there's not generally a one-size-fits-all approach. You generally have an inhaler or a series of inhalers, or a controller inhaler, which typically you take twice a day, and you should take that even if you're feeling well. So if your doctor has told you to take it twice a day, even if you're not experiencing any symptoms of asthma, you should take it anyway, because that prevents the your asthma from exacerbating then as well. There's a reliever inhaler then, so when it's getting a bit worse, you can take your reliever inhaler to ease some of the symptoms. Then there's a number of other different treatments for, like, there's steroid tablets, and we actually have a campaign at the moment to raise awareness about steroid tablets for asthma. So these are typically prescribed for asthma and COPD when people get flare-ups, so when their asthma gets really bad. However, kind of clinical best practice says you shouldn't be on more than 2 courses of steroid tablets for in any kind of 12-month period. But we know there's a significant amount of people actually on more recent data we had suggest that. So at the moment we've got a campaign to raise awareness about that for people to, because if your asthma is well managed, really your asthma for the vast majority of people who don't have very severe asthma, you should be able to live perfectly fine. You should be able to do everything anybody else can do, whether that's exercising, work. Shouldn't affect your day-to-day life really. When it does, or when you're having trouble sleeping, there's a number of different kind of signs of this. It can signify that your asthma is uncontrolled, and that's when you really need to see a healthcare professional and take action. But then maybe just going back to the treatment, sorry, you asked me about initially. So the steroid tablets, and then there's something really high-end drugs then called biologics, which are just starting to be prescribed for asthma. There's very, very few asthma patients on those. It's for severe asthma, really. And they're very, very expensive.
Are you talking about those as part of a maintenance program?
They would be typically, and as far as I know, but there's very, very few people in Ireland on them currently. So we're currently doing a bit of work with a severe asthma group to look at that kind of treatment option as well, and looking how we could maybe reduce some of the barriers to getting those higher end treatments for people. But again, they're very, very new in terms of treatment of asthma. So
should they move away from smoky fuels and towards electric vehicles and all that? Should that help in the long run with people with conditions like asthma and COPD?
Yeah, absolutely. So clean air is something we've worked on for many, many years, kind of in an advocacy side of things. So, would have, been very much for the smoky fuel ban a few years back as well. So things like that, air pollutants can be a really significant trigger for a lot of people's asthma. So we did a survey a few years back. I think something like 76-78% of our members at the time who were surveyed said that they can actually feel the effects. So they know when the air outside is bad. They can tell straight away. So burning any kind of solid fuels, fossil fuels are particularly bad. Your coal and your turf, but even engine idling, so like having car emissions in the air, all of these things can trigger people's asthma. So it's it's one of many reasons we should look to clean up the air, but particularly for people's health.
I remember standing at bus stops, on the old buses, this belch of, if you were standing behind the bus, you get this belch of
absolutely
exhaust pipe. I can imagine it would be terrible for somebody with a condition.
Yeah, and it causes, I think the EPA, the Environmental Protection Agency, estimate that air pollution causes 1,600 excess deaths per year. I think it's something like 4 million globally, according to the WHO. So it's a serious public health, and again, it affects people with asthma particularly. It's something we're kind of very passionate about and always trying to raise awareness about as well.
So what about asthma attacks themselves? What advice would the society give on how to manage them best?
So there's something called the 5-step rule. So it's 5 steps you should go through, and I'm not going to recount them because I can't remember right now, to be completely honest. But it's really important, if you do have asthma and you're having flare-ups or attacks, that you understand the steps to go through. Also that your family understand it, because it's not just obviously the person with asthma. They could be so incapacitated or not able to think in that moment, because it can be very scary to have a serious asthma attack. I mean, somebody once described it as trying to breathe through a straw to me. So I don't have asthma, and I joined the Asthma Society in January this year. So I've been learning a lot about the condition since, but one of our the patients that we work with told me the best way he said he could describe it is, imagine trying to breathe through a straw, and that straw getting thinner and thinner. So for me, that really went, wow, okay, that must be really scary. And you can imagine if you have a young child as well with asthma and they're experiencing an attack, it's to know what to do in that circumstances. So as I said, there's something called the 5-step rule, a number of steps you can go through, and ultimately then call the emergency services if your reliever inhaler isn't working, or any of the other steps you go through are not working. And
those 5 steps are available on your website?
Yes.
So if anybody's out there listening with asthma, I would advise them definitely to go to the website, and those 5 steps are definitely on it.
Yes, absolutely. So
you might give the website now, and I'll ask you later on to give it again.
Absolutely, thanks. It's asthma.ie, very simple. You can find a whole load of resources there. We've got the 5-step rule. You can download your asthma action plan. We've got various different leaflets and booklets about asthma and pregnancy, asthma in your child, asthma and hay fever. Also got a bunch of webinars there as well. So we hold webinars every 6 to 8 weeks on different topics, and they're all available to watch back as well. And probably the most important thing on the website, if I may mention it now, is we actually have a free advice line. So we have a team of 8 nurses and a physiotherapist who can provide free advice to people with asthma, or parents or carers of people with asthma as well. And we have a WhatsApp messaging service as well. So you can just text in with a question, and you'd be answered by a fully qualified healthcare professional. And the advice line is really amazing because it gives you can have a half an hour session over the phone with a qualified nurse or physiotherapist, and you can have as many of those as you like. So it's really, really helpful for people, because as you know yourself, when you go into your GP these days, you're lucky if you get 15 minutes to discuss whatever it is you need to discuss, and you often come out going, oh, did I ask the right question? I forgot to say X, Y, and Z. A lot of people are using the advice line to talk to our nurses and give them self-management tips, but also really importantly to advise them what to ask when they go to their GP. So you're really making the most of that time and maximizing your treatment. So the advice line number and the WhatsApp number are all on the website there as well. So really important services for people. So please do use them.
What are the statistics behind asthma, the amount of sufferers in Ireland, which is really important for our listeners?
Of course. So Ireland actually has one of the highest rates of asthma in the world, one of the highest, unfortunately, rates of asthma deaths in the world. So the HSE put the number of people with asthma at 450,000 currently. So it's really, really significant portion of the population.
There was never any research into why.
No, well, there probably has been, but we don't know definitively. It could be something to do with our weather, obviously with cold and damp weather, housing stock as well. Mold in houses is a big issue for people. It could also be that we're better at diagnosing asthma maybe than some other countries, because it's quite difficult sometimes to diagnose the condition. So there could be a number of different factors.
That's a very good point, actually.
So it could just be that it's picked up more here than in other countries. We do know it's rising. That the number of people, generally speaking around the world, that the number of people with asthma is rising. Again, that could be due to air pollution, could be changes in climate. Even climate change affects it. So in terms of like the more humid weather, you can release more pollen spores, so that can trigger people's asthma. So there's all those different factors as well. So 450,000, but 890,000 people will have asthma at some point in their life. So the thing about asthma is that it can actually come and go. So you can develop asthma at any point in your life, old or young. It's more common for children to have it and then not have it later as adults. But you can develop it at any point in your life. So 890,000 will have it at some point in their life. And they estimate 1 in 10 children. So it's really, really common. Everybody, I would say, probably knows somebody with asthma, yourself included. My brother has asthma. I'm sure everybody is a family member, and it runs in families as well. That's the other thing to mention, or it can run in families. It's usual for it too. So if you have a parent with asthma or grandparent with asthma, it's likely that somebody, one of your siblings may have asthma as well.
So COVID must have been a big aggravating factor, since it's a respiratory condition itself. Yeah,
absolutely. Yeah, and it still is. So it's still obviously around. So winter is particularly tough for people with asthma, or can be, because you've got COVID more prevalent. Any respiratory condition that you can get on top of your asthma can be, really damaging for your health and a real kind of exacerbate your symptoms. So COVID, the flu, RSV. So it's really important for people with asthma. One of the many things they should kind of be aware of coming into winter is that they're getting their vaccines. So, that it's different again for different people, but people should speak to their GP and know which vaccines are advised for them every winter season, and it's really, really important, and protect them from those kind of worse symptoms of COVID and RSV and flu as well.
So if there's somebody out there right now listening and they've just got a diagnosis as having asthma, what advice would you give to them?
So I'd advise them to go onto the Asthma Society website. We've a lot of resources just to learn a bit more about asthma, what the condition is. There's some nice infographics there, just some web pages there will tell you a bit more about the condition, how it develops, how you can best manage it. We have like an infographic for top tips for managing your asthma. I mentioned at the beginning the asthma action plan. That's really important. So anybody with asthma should have an asthma action plan, really, and should be working with their healthcare provider to complete that together and understand it, because that's a really powerful tool for somebody with asthma to manage their condition. They say with asthma, you do need a healthcare professional to help you along the way. What you should do what's called guided self-management. So it should be a condition that you should be able to manage yourself, but obviously you need the guidance of a healthcare professional. So first thing I would say is go on to the asthma.ie website, have a look around at the resources. It could also if it's not you, if you have a child who's newly diagnosed with asthma as well, there's a wealth of information there as well. If you have any questions, any concerns whatsoever, do use our advice line or our WhatsApp messaging services. Our nurses are fantastic. We get emails constantly from people telling us how much those nurses have helped them and kind of live kind of better lives and live symptom free. So that's the first thing I would say is, familiar yourself with the resources. Obviously seek the help of a healthcare professional, but do use our advice line and WhatsApp messaging service to help manage your condition if you need it.
Inhaler technique is extremely important. I presume you also have something on the website that explains the best way to use your inhaler.
Absolutely. So we've got a series of videos. Also, there's so many different types of inhalers, so it's not a one size fits all approach. So we've got a series of videos on the website showing you how to use whatever inhaler or combination of inhalers you've been prescribed. So you can go on there, have a look through those videos. Again, if you have any questions, one thing that the nurses are telling me that people are doing recently, which is fantastic, is on the WhatsApp messaging service. You can take a video of yourself taking your inhaler, send it to our nurse. They'll have a look at it and tell you, if you're doing it correctly, if there's things you can improve as well. But yeah, you're right. Inhaler technique is really, really important. So you could be taking your controller inhaler as prescribed, but you may not be taking it in the right way, which means that all the drug may not be getting into your lungs. So you could use, for example, a spacer device, which is something that goes on the end of an inhaler, which helps you inhale the drug better. So yeah, really, really important to familiarize yourself with the different inhalers and how to use the different inhalers. And again, all those resources are in asthma.ie. Your healthcare professional as well, your GP, will be able to do that. So, ask them about that. They can look at your inhaler technique and advise on how to improve it if needed as well.
It's really important.
Yeah.
Schools have to deal with children with a lot of conditions. For asthma, is there any advice you'd give to schools?
Again, familiarize yourself with the condition. We actually have a program called Asthma Safe Schools. So in the case of an asthma attack, there's obviously the child should have their reliever inhaler with them. However, schools can't currently under regulation hold that medication on the premises as well. So it's not like an EpiPen, for example. So schools are not licensed currently to hold that unless they've got a very specific training in how to administer the medication. So we have a program whereby we offer free training for schools. So for teachers and SNAs, they can come get qualified. They do a one-day course which takes them through asthma, what to do in an asthma attack, and that will certify them. It's certified by the Pre-Hospital Admissions Council, if I've got the name correct. It will certify them, the school then, to hold that medication on the premises, and they can be used in the case of an asthma attack.
Yeah, I went through your website and I know it's very, very comprehensive, in particular for schools.
Yes, yeah, we have a lot of resources there for teachers. We've just had a webinar, so every September we'll do a webinar, typically one for parents of children going back to school. So because September there's something, a phenomenon in the US called peak week. Right. Which is, I think, around the third week in September. So what happens is a real jump in the number of people experiencing flare-ups of asthma during that period. And there's a number of factors for that, like all the respiratory conditions kind of coming out as the weather turns, but also everybody going back to school and college, and everybody mixing once again. Can be viruses can spread much more easily. So September is August really and September are really good months for parents to be thinking about, okay, now we got everything prepared for our child to go back to school, and what do we know what to do if he's got issues, he or she have issues with their asthma. But similarly then for teachers and special needs assistants. So we have that program that I mentioned, but webinars as well every August, September for teachers and for parents of children going back to school, because it's a really difficult time for some children. And
I know when I was a child, I was playing a lot of sport, and the advice I was given at the time was to take 2 puffs of my reliever before I started, and carry the reliever with you in case.
Yes.
Is the advice still the same?
I don't know, to be completely honest, and it probably depends on the person and the severity of their condition, but people can and should exercise with asthma. It can actually really help with their asthma. Yeah. So we do have a booklet on the website again called Asthma and Exercise. I'll talk you through all of that, but you need to follow the advice of your GPs. If that's what they're telling you, that's absolutely what you should do. But it is important to have your reliever inhaler close by as well, just if you experience a flare-up. And I know of some children and adults, for example, find it really difficult to exercise outside. Some of them in the summer months because of hay fever and pollen, and then some of them in the winter months because of the cold air. So again, it really depends on the person and what triggers their asthma. But it's important to be aware of what medication you need to have on hand when you're exercising or participating in sports as well. Absolutely.
Would the breathing techniques in yoga be helpful?
They can be. There's kind of mixed evidence on the effectiveness of some breathing techniques, and there's different programs you can do and things like that. So they can be helpful, but again, it's really important to talk to your healthcare professional, because they'll be able to advise what's best for you in terms of the medication as well. But it can be helpful for some people, yeah. Absolutely.
So let's talk about the Asthma Society itself. When did that come on stream, and what was the purpose of it?
So the Asthma Society has been going for 50 years, or just over 50 years. Yes, it's been around a long time. Just celebrated their 50th. I say there because I only joined in January. Celebrated our 50th anniversary towards the end of last year. The purpose of the organisation is to help everybody with asthma in Ireland live a full life and symptom free. So, we do that through a number of different ways. So there's about 19 of us in the organisation currently, but 9 of those are clinical staff. So they are, again, manning the advice line, and then we've got a patient services team to support them to book the appointments when people call in, do all of the reporting and that kind of thing. So we do advice through the advice line and the WhatsApp service, education through the booklets as mentioned, the infographics, posters, things like that. We also do a lot of work with healthcare professionals. So a lot of healthcare professionals will use our resources with their patients, or they can refer patients to our services as well. So we've got a form on the website. So if the patient agrees, obviously, to have their information shared, the doctor or nurse or pharmacist or whatever it may be can actually refer their patients to our services to help them in between their visits. So the education the advice, education, advocacy is a big part of what we do as well. So looking at things like clean air, like we spoke about, costs of medication in Ireland. So it can be, unfortunately, really prohibitive for a lot of people. Yeah. We know that people have had to forego some of their asthma medication due to the cost of living. So we do quite a bit of work on that to advocate for more supports for people with asthma, and even access to medication as well. It's the advocacy side of things, and the other side of thing we do is the program. So the Asthma Safe Schools program I mentioned as well, going out and actually working with schools. So that's kind of broad. Right. Kind of range of what we do. Is that we've been going for 50 years now. Work very closely with kind of a range of different people. So asthma patients first and foremost. So we aim to be the representative body for asthma patients in Ireland. So we have a huge number of people, across our social media channels, subscribe to our newsletters as well to learn more about the condition and how they can manage it. We work with healthcare professionals. That's really important for us as well. That we also have a medical advisory board, I should mention. So in terms of our governance, we have some of the top respiratory specialists in the country who sit on that. So any of the resources I mentioned, any of the webinars I mentioned, they're all approved by our medical advisory group. So, you can be really rest assured that all of the information in there, and they need to be updated constantly as well as medical guidelines change. So our medical advisory group will revise the content of those every so often, and we'll update booklets as more evidence and data becomes available as well. So that's a really important piece of what we do, is working with clinicians as well. We also work with, obviously, the governments and around the advocacy issues I mentioned, and different other charities as well to advocate for different things at different times. And we work with the pharmaceutical companies as well to they're producing the drugs for asthma patients. So it's important that we understand the landscape out there as well, and combine efforts. So it's kind of a broad sense of what we do and in the organisation, but very much patient focused. And our first and foremost goal is to be there for patients and to provide those services for patients.
And how are you funded?
So we're funded, quite a bit of our funding comes from the HSE. So they will fund our advice line and WhatsApp services. We actually also run a COPD advice line. So there is a COPD charity called COPD Support Ireland. So for anybody, with COPD or caring for somebody with COPD, they've got a wealth of resources on their website as well. But we run the advice line kind of in association with them. So the HSE will fund that side of things. The rest of our funding, we get some funding from some pharma companies, for example, for specific programs or campaigns that we might run. And we get some funding from trusts and foundations also. And then finally, we do get some funding then from the public, so people fundraise with and for us. And that's really, really important. So, if anybody would like to support us in that way, it's asthma.ie/donate. So people can donate, people can go and do a fundraiser for us. People, have run marathons, have climbed mountains, organised football games, all of those kind of things for us. And we're really, really grateful for that support, because that allows us to, go beyond what the HSE will fund us for, which is fantastic, but also it's just to reach more people with more information as well. We know, again, the need is so great, 450,000 people, and we're supporting quite a few people, but we know we could do more as well with more funding. So asthma.ie/donate is the website. There is the webpage there for that, but that's an important part for our funding as well. So
you'd be delighted to know that we're right at the end of our time. Is there anything else you'd like to put out?
No, I think that's it. Again, asthma.ie is the website. Please do use our resources. Everything's completely free and open access, so you can go and download whatever you need there. Asthma advice line and the WhatsApp messaging service, completely free service, a really fantastic and important service as well. Qualified nurses and qualified physiotherapists there to support you as well. So please do avail of it. We're there to support people. Nobody should have questions, and if they do, we're there to help them on their journey.
And I can vouch because I read every piece of information on your website. It's very, very comprehensive and very easy to use.
Oh, good.
So if there are people out there, I would definitely say to them, go on the website. There's a wealth of information and they will help you through the management of your asthma. Aiden, thank you so much for coming in.
Thank you very much for having me.
You're very good.